Hi, I'm Frank DeFelice.
And I'm Jim Cassis. We've both been nurses for over 25 years.
The thing is, Jim and I have spent almost our entire careers in the operating room.
And there's much more to nursing than just the operating room. The nursing profession is a widely diverse field.
Yeah, Jim, with many specialty areas. There's the ER, pediatrics, hospice, school nurse, the list goes on and on.
We are on a mission to explore the nursing profession. That's why we created our show, Real Talk with Real Nurses. This journey will take us out of the OR and out into the nursing community.
Our show is driven by interviews with nurses who describe what they do, how they do it, and share their personal stories. So welcome to Real Talk with Real Nurses.
Or as we like to call it, The Jim and Frank Show!
And that too, yeah.
Another episode of Real Talk with Real Nurses coming right up.
Welcome to Real Talk with Real Nurses. I'm Frank DeFelice.
And I'm Jim Cassis.
Welcome to the Nurse Anesthetist Show. First off, you should know that nurse anesthetists are also called CRNAs, which is Certified Registered Nurse Anesthetist. You guys also have names like Advanced Practical or Practice Nurse, -A for anesthesia, specified area. And Jim, do you have a internet definition for us?
Yeah, for our viewers, we have a definition of what a nurse anesthetist is. So nurse anesthetists are advanced practice nurses responsible for administering anesthesia and monitoring patients during surgeries and other procedures. Due to their specialized skill set, they are experts in critical care and airway management.
All right, with that, we're going to welcome our guests. We have Chris Chilacco and Helen McGuire, both real live nurse anesthetists.
Frank, we couldn't get the dead nurses for
No,
Halloween?
dead ones were not available.
All right.
So we're going to start with you, Chris. We just want you to talk about your background, how you got to become a CRNA, and how long you've been working, and then we'll go to Helen.
Well, I worked as a ICU nurse on a heart transplant unit a while back. After I did that, things were changing there. The patient ratios were changing, and they were trying to push a little bit more patients on a nurse. So I decided to make a move, and I made a move to the emergency department and trauma unit and stroke unit. And so it was fun. It was a huge learning experience. But having worked there 5 years, things started getting similar, and they were changing.
You mean you got bored?
Well, no, not boring. It was never boring.
Okay.
But management was making changes in the emergency department and expanding it and changing things, and patients in the hallway, and trauma and stroke. So it was
Getting dicey?
yeah. And a friend of mine started anesthesia school, and she was a year ahead of me and kind of just pushed me. You should go, you would like it. So that's kind of what got me over the hump.
And how many years have you been a nurse anesthetist?
So I graduated in 2004, so 18 years.
Okay, very good. And Helen, you're much younger,
Yeah,
right?
I'm the rookie of the group. I'm the youngest in the group. Yeah.
And your background didn't start out in nursing at all, right?
No, nursing was my second career. I have a degree in journalism and psychology from Rutgers. And I could only wait tables with that degree.
Right.
So I was a waitress for a while. And then I went back for nursing. And then I was a nurse for about 4 years before I went into CRNA school.
Did you always have the idea to go to CRNA, or did you?
No, actually, when I first became a nurse, I didn't even know what a CRNA was. I wasn't even aware of that as a profession. And it wasn't until I started working in critical care that I came into contact with CRNAs, dropping off patients from the operating room in the ICU and my colleagues, because sometimes when you're in a critical care unit, you'll have people studying for interviews for CRNA school
Right.
or looking into it. And I had some colleagues that were reading about it, and they're like, "Oh, you should look into this." And I'm like, "Oh, what are you reading over there?" "Oh, I have an interview for CRNA school." And I'm like, "Wow." That's kind of how I got introduced to it. But as a new nurse, and especially as a journalism major, I didn't even have any clue what a CRNA was. Yeah.
And then how long have you been a CRNA?
2 years.
2
2
years.
years this past October.
So, so just out of curiosity for our viewers, Chris, can you tell us about your program to become a CRNA versus, then we can ask Helen so people can see maybe how it's changed over the
sure.
years?
Well, the program, I went to Villanova, and we started with Lankenau Hospital as our clinical site.
yeah, okay. Cool.
But that immediately changed. Like after the first semester, before we even started our clinical, our school then connected up with Crozier Chester Medical Center in Upland, Pennsylvania. So we had the first year, I think, was
Think back, Chris. Think back.
We're going to have a special
hard.
little swirly effect.
I know, right? It was like straight up school. And some of the courses were done at the hospital at Chester Crozier, and some of the courses were through Villanova because we had to have a certain amount of credits through the college to get our master's degree. So that's pretty much how the program went. It was an 18-month program at that time.
18 months, okay.
And yeah, so we graduated with the master's in anesthesia, and then our clinical hours also matched that.
Okay, and we'll get into the new way, or the newest way, with you, Helen, later on in the...
Sure.
Did you have to take boards or anything?
When we finished,
Yes.
yes, we took our boards to get certified as a nurse anesthetist, which of course you had to pass.
Right.
Right.
And did you do all your clinicals at Lankenau?
Oh no! So
you tried.
clinicals were everywhere. Clinicals, maybe you did. Well, if you were in your pediatric rotation, which wasn't until like far into your second year, then you went to a children's hospital probably, and you might spend 3-month sections at a different hospital. Yeah, so you traveled.
Yeah.
Yeah.
All right. Jim, you have some demographics for us, some statistics?
Yeah, Frank likes demographics and statistics, so
Well, I find it...
He finds it interesting.
I find it interesting because I looked at statistics and demographics about my own
Yeah,
career and was shocked at it. A lot of people don't study their own statistics.
so this would be news for
You guys just found out how much how much you should be making.
Yeah. So these demographics, these statistics came from the U.S. Bureau of Labor and Statistics 2021. So currently in the U.S. there are 43,950 nurse anesthetists.
Did you know that?
I thought it was
You're
a
very-
little more, but
You're very specialized.
Every website you look at, there's slightly
A little
different
different.
answers. You're looking at surveys and
But
stuff.
this is why we use the U.S. Bureau of Labor and Statistics.
Correct.
So the average age of a nurse anesthetist is 44 years old. We're not asking anybody their ages, Chris. A note for comparison: the average age of an RN in the U.S. is 52 years old.
yeah.
The median salary of a nurse anesthetist in the U.S. is $202,470 annually, or $97 an hour. Note for comparison: median salary for an RN in the U.S. is $77,600 annually, or $37.31 an hour.
And the top 4 states for median salaries of nurse anesthetists, Connecticut is $276,540, New Jersey $263,850, Illinois $250,280, West Virginia $247,650. Industries and places where the highest levels of employment for a nurse anesthetist are: Offices of physicians, 23,270 are employed there. General medical and surgical hospitals, 13,990. Offices of other healthcare, whatever other health practitioners mean, 2,670. Outpatient care centers, 2,260. And college, universities, and professional schools, 960.
So some other demographics for the U.S. for a nurse anesthetist for 2021. 63.9% of anesthetists are women. 36.1% of anesthetists are men. So note for comparison that there are 3 times as many nurses that are male in anesthesia versus just what a regular proportion of regular nurses. So it's 12% of registered nurses are male in total, and 36% of anesthetists are males in anesthesia. So what do you guys think is the reason that there's so many more males?
Actually, I thought it might be more men in anesthesia.
There are. It's 3 times as
But
many.
I mean,
More
I
than that.
thought
You
even
thought
You
the
thought it was
number
higher.
would be higher.
And yes.
I think, personally, I think it's because the pay scale is high, and that's what I think, because it's more money than any other advanced practice.
You too, Helen? Or
I would agree, and I think that women. This might be a little. I don't know. You can disagree. This is just my opinion.
Right.
But in the nursing field, women tend to be kind of like more motherly. But in the OR, your patients are asleep, and I feel like you sometimes lose that.
you don't need the nurturing
Connection.
component.
No, that's not what I'm saying. But it's a little more.
More compassion, maybe?
Yeah, I just think you're moving away from that coddling. Not that we don't coddle in anesthesia, because we certainly do. We use verbal anesthesia every day. But yeah, you're moving away, and it's more of an independent job. You're by yourself. You're taking the bull by the horns. Like maybe a little more masculine in that
Right.
regard.
So
Does that make sense?
the independence.
I don't want to sound
Yeah, the independence.
exactly.
Which brings us to the next question, which you guys are hitting on. Why did you decide to choose nursing, this specialty, nurse anesthetist, as your career? Chris, start with you.
Well,
Why did, you hinted on it a little bit. Things were getting a little
it's
dicey.
nice
and
to have one patient. I mean, you guys work in the OR too.
That's-
One patient at a time.
That's
It's-
our pro, yeah.
It's quality care, 100% right there.
Focused on one.
And that's a thing. That's a thing. It's challenging. You practice independently, and you practice with one patient.
Okay.
Yeah, you can't beat it, really.
And Helen, why did you choose nurse anesthetist?
I was burnt out in the ICU. I was very burnt out in a
And
similar
you were only there for,
3 years.
right? Doesn't take long sometimes.
It was a very physically demanding job. We were moving morbidly obese patients. We were taking on more patients than we probably should have. And so I was looking for a new profession, and I wanted to go back to school. And like I said, some of my colleagues were studying, and I heard the pay was pretty great. That was also a factor. So it seemed to me like the transition from, at least where I worked at UPenn, was from ICU to if you were going to go back to school, most of my colleagues that were going back to CRNA school. So they definitely influenced me in that way.
Okay.
And the pay definitely helped
Oh,
push me in that direction.
Right.
Yeah.
I initially went in to be an RN for nurse anesthesia.
Oh, yeah.
But I had a 1-year-old, a 6-year-old. I got through that. I went to Stockton. I finished. I was in my 2nd year, doing well, and I just said, it's just too much raising kids and.
It's a lot, yeah.
Yeah. But anyway,
It's never
So-
too late, Frank.
it is. When you're 59, Helen, it's too late. Yes.
I think we had an 80-year-old guy in our nursing class.
Oh, my God.
And he
No
was doing
way.
it, but he was doing it for the
Get
fun.
outta here.
For
For the fun of it.
For the fun of it. Yeah. Yeah, maybe I'll go to nurse anesthesia school for the fun of it. But, anyway, so on the internet, just looking around, we have a generic or pretty close to what it takes to become a CRNA. And I'll let Helen, because I didn't let you finish before, since you most recently went through the ringers here. You need your BSN, then you have to sit for your NCLEX and be licensed RN.
I'm sorry, Frank, what's the NCLEX?
The nursing board for RN.
Okay. Our viewers may not know that. Right.
I apologize to the viewers. All right, so and then it's 1 to 3 years RN experience in ICU or critical care. And then you have to apply for acceptance into an accredited nurse anesthetist program. And then you have to pass the nurse certification exam for CRNA. And they say this whole process takes about 7 to 10 years. If you're going from the beginning, like you were already in critical care, so you had a little bit of a jump.
Right.
So Helen, if you want to speak to any insight more onto that, or is that pretty much it?
Yeah, I'll add to that.
Okay.
So depending on the school that you're applying to, some schools require more ICU experience than others. So some you can get away with just 1 year in the ICU. Some may require 2 to 3.
Okay.
Some schools are requiring that you take what's the exam? I can't think of it right now.
The GRE.
The GRE. Some schools are requiring the GRE.
What's the GRE?
It's like your college exit exam. It essentially is proof that you have like a college education.
So it's for
very
it's an entrance
general
exam for grad schools, I believe it is?
entrance to
Yes,
grad school.
yes.
Correct.
Okay.
Yeah, but it's very general. It's not just science focused.
So it's just grad
Yeah.
school, right?
So some schools are requiring that. And then there's an interview process. And I don't want to glaze over that at all because it's very important. The interview, at least for me, the interviews are very intense. Some of them are recorded. You sometimes have a panel interviewing you. And it's a huge part of getting accepted or not into a CRNA program.
Your hair has to be just right.
Your hair's on point.
And why
Your wardrobe.
Why is it such a big part of it, Helen?
I think that when you're interviewing, they want to get a feel for your level of experience. You're getting asked questions about scenarios. For example, they handed me an EKG strip and they said, interpret this EKG and how would you treat that? And they want to know what's the sickest patient you've taken care of, why were they the sickest, and what types of drugs were you giving them, and what was the outcome, how did that patient do? And they want to get a feel for your personality. You get asked questions about ethics. They give you ethical scenarios. What would you do if a patient's family member came and they had a religious concern? How would you handle it? Integrity. They want to know that you're a good person.
Right.
And then your personality too. They ask you every interview I've done. They ask you, what do you do to relieve stress? What do you do in your free time? And what are your hobbies? They want you to show that you're a well-rounded person that has a life outside of work. So
Well, most
huge part is the interview.
Well, most programs, especially if there's limited seats, they don't want to waste and have somebody drop out after a year.
Yeah.
So competition is heavy then. There's a
Very.
limited amount of seats.
Very
Yes.
much. It's highly, highly competitive. And I would add to that when you're applying, in addition to the interview, they're going to look at your undergraduate nursing GPA. So when you graduated as an RN, that's something that's heavily weighted for your acceptance. They're going to see, do you have a 3.5 and above? That's kind of what you're looking for.
Right,
So I would suggest anyone that's looking, if you're in nursing school now, if you're looking for any graduate program, really, make sure you keep your GPA up.
Right, so-
if you're planning to go for an advanced
Yeah.
nursing.
So that underwater basket weaving is not going to count.
No, not in CRNA school.
All right, and then I just wanted to mention a special note. You guys are also advanced practice nurses, -A for anesthesia specializing. And for people out there, I mean, me and Jim were on the computer. It's very confusing, the advanced practice nurse, a whole thing, the way it goes. And we just want to mention that that's just one type of an advanced practice nurse, and that there is like certified nurse midwives, nurse practitioners with many subcategories,
Yes.
clinical nurse specialists, and then of course your category. So just because you have so many names, I figured I'd just put it out
It
there.
wasn't that long ago, didn't they grandfather, because not everybody's programs were the same.
That's true.
They
Yes.
grandfathered a lot of nurses who were quote unquote, just CRNAs to nurse practitioner? Because I think New Jersey required that you had to be a nurse practitioner to practice.
Well, I think initially when the anesthesia program was for nurses, you didn't have to have your master's. So they've changed that, and I think even now, since you have to have your doctorate, or do you have your doctorate?
So CRNA programs, we're in actually like a transition phase right now. All schools by the year 2025, that was what they told us when I was in school, need to be a doctor of nursing practice when you graduate as a CRNA. So a lot of schools in the transition period, they're in their first year of being a DNP, or everyone's kind of fumbling through. I did a DNP program, but I have colleagues their school wasn't requiring it to be a DNP. So for the long history of the career, it's been just a master's, and now by 2025, you'll have to have a doctorate.
It's a good thing you guys are making $263,850 a year.
Well,
might have to go up
yes.
if you're doctors.
That's right.
Yeah.
Just saying,
Why not?
it's a lot of education. All right, Jim.
So, before I ask my next question, not to get too far away from that, is now they're going to want nurse anesthetists to become doctors of
Anesthesia.
anesthesia nursing. Why do you think that is?
I mean, I can tell you just from what I learned, I think they want nurse anesthetists and all advanced practice nurses, because there are DNP programs for nurse practitioners as well right now. I think they want nursing to play a more active role in making changes in the hospital in an educated way, in terms of doing research to, change hospital policy, for example. And a big component of the doctorate is research. And, you have a research project, you write essentially a thesis. It's not really a thesis because that's what you write for a PhD, but it's similar. And I think they want us to have a voice and an educated voice. I have a degree, I know how to research, I know how to read research papers and look at data and interpret data. And then as nurses, we're prepared to enter the field and make changes, and that's
Which
kind
is
of what
really
what
a
they
full circle kind of thing, because
sure.
hospitals used to be run by doctors and nurses, and then we've gotten away with that, and they were all run by business people. Of course, they destroyed healthcare and every other. I won't go my anti-corporate rant.
That's another show, Frank.
Chris, you're stepping all over my lines.
And now it's like they're looking at that again, like that actually is the answer, that we should be running our hospitals.
I mean, we're the largest the group in the hospital, right?
Yeah,
it's
exactly.
all nurses.
And we're run by a guy with an MBA. Like, come on. I mean, just saying.
All right, that was an interesting overview of what it takes to become a nurse anesthetist. So, next question we'd like to ask our specialist here, our guest. Chris, what do you like about your specialty? And then we'll go to Helen.
That's a good question. Jim, I'm
glad you asked.
I love the autonomy, and I enjoy getting to know my patient for the small amount of time that I'm taking care of them. And it's challenging every day. There's something new and different. You never know everything always. Yeah, I have a good relationship with the doctors and other nurses that I work with, and it's exciting. It's just a really good field. I love my job.
What about you, Helen?
I would agree. I like the autonomy as well. Being able to kind of get through the day with no one. I make all the decisions for the most part. Not all of them, but a lot of them. And I always tell my patients, my job is like bartending. I listen to people's problems and I take their pain away. That's what I do all day. You meet them, they have a problem, and I'm going to help you fix it. It's rewarding. patients come in and they're scared, and it's definitely, a great feeling to be able to ease their fear with drugs sometimes, but also by just talking to them
Right.
and take away their pain, and help them get through, which is often like a pretty traumatizing time. If they're having a procedure or a major surgery, they're scared, and we get to help with that.
Right.
Do you put a
That's
little
the best
tip?
part.
Do you put a little tip jar in your anesthesia machine?
Of course, just like a bartender, just like a bartender. Yeah, and I would also agree. I want to add that it's the whole nursing profession. You never stop learning, and it's no different being a CRNA. Every day is a brand new day. Every challenge is every patient's a new challenge, and I'm always asking my colleagues, for
Have you ever seen
advice,
this
and
before?
and my colleagues ask me, which I'm always impressed by. Hey Helen, I'm like, what are you asking me for? I just got here. Right. But, maybe I took care of that patient yesterday and they hadn't taken care of that patient for a long time. We ask each other, we help each other, we teach each other. So I like that.
So patients get a lot more personalized
Yes.
care.
I think so.
And you're able to discuss that with your colleagues.
Sure.
All right, so now we know what you like about your job. What do you dislike about your specialty? Why don't we go with Helen first?
What are the cons? What are the cons?
I would say autonomy is a pro, but it can also be a con, right? Because, for example, just the other day, it was 3:00 and I saw Chris. I didn't even know she was there. I don't really see my colleagues all day long because you're in an OR by yourself, and I could go a couple of days and maybe not even see Chris unless we're in the lounge having lunch together. So you're kind of on an island. In the OR, we do work as a team, but the anesthetist is kind of on an anesthesia island, right? Like, there's not really someone with me the whole day taking care of the patient in terms of the anesthetic.
It's like they got the
So-
big beach mansion. We're in the huts, Frank.
Yeah. So, but that can be a good thing. But sometimes you can see how that could be a con. You're kind of there on your own.
Sometimes you just want to be in a hut.
Yeah.
I guess you don't have that immediate supported interaction that you can get if you were working.
Right, throughout
Right.
the whole day.
Throughout the day,
Yeah, of course
right.
I have my anesthesiologist
Right.
who I can consult at any time.
Right.
And they're often coming in the room a lot. But for the most part, you're kind of by yourself, which can be a con. And I can't think of anything else.
What about call?
The
Because
call.
I think that's something the audience, I know that we got to make them aware in PACU, OR,
The
nurse
operating
anesthesia.
room, right?
You make a commitment to, say, a hospital. That's a commitment. Call is a big commitment. And go ahead, I don't mean to cut you off.
Sure. So staffing and call and shift length is all dependent upon the facility where you work. Now you can choose to sign a contract that has great hours, and that's the great thing about our profession is you can go anywhere and pick your hours if you choose. But some places are going to have requirements, 12-hour shifts, 16-hour shifts. Some places require CRNAs to do 24-hour in-house shifts. Our requirement where we are now in our group is, for me at least, my contract is 5 calls per month. But again, you can choose a job that doesn't have a call requirement, right? Or you
Surgery
depends.
center,
You
physician's
could work at a
office.
surgery center. You could do only outpatient Monday through Friday, no nights, no weekends, no holidays. Yeah, it depends. But it can be a burden because you're on call on a Saturday, for example. We do call from home, which is great, but you can't really go anywhere because you could get called in at any time. Or you could be in the hospital doing a 12-hour shift and you're there until 7 p.m. I think we're lucky because there are so many places and roles as an anesthetist that your hours can be really flexible. You don't have to limit yourself.
Okay. Chris, what don't you like about your job? Or what are the cons?
What are the cons?
Better said.
Well, mostly the cons are pretty much what Helen has said. But they can also be the pros too. So you might want to do a 24 and 2/8, and then you're done for 4 days. Or you might want to do a 24 and 16, and then you have 5 days off. But if it's not your choice,
Right. That's
and
where
you
it
sign a
gets-
contract and you're doing that and you don't like it, then that makes it a con. So, you know, you can work anywhere in the United States as a CRNA. You can go to the Midwest and make $300,000 a year because no one wants to go there. Or you can work in a cushy community hospital and make a little less because you're doing easier cases and not requiring lots of monitoring and stuff like that. So, you know, it's all depends what you want to do. And
A lot of choices, which is
a lot
pro,
of choices.
which is a
So
pro.
many choices. Yeah.
Okay. How about malpractice insurance? Is that something your company pays for you, or I just figure you guys have such more. We have malpractice insurance, but you guys have higher. You know, obviously your responsibilities are much greater than ours. I would imagine that malpractice insurance, is that something that's affordable and not a problem?
Malpractice insurance is fairly inexpensive.
Okay. That would be-
Usually, if you go to work as a W-2 employee, it's paid for by your group or the hospital you're working
Okay.
for.
I just was wondering about that. I just figured.
But does that cover your group or you personally?
You personally.
And some people choose to get additional malpractice insurance on top of what their company or hospital provides. It's kind of optional.
Right.
I personally don't have extra on top of what our company provides, but it's an option if you choose.
Okay. Just curious about that. So I guess the next question is, and we're almost ready to wrap it up. You guys done good so far. What do you think lies in the future of your specialty? I mean, think just 5, 10 years in the future. If you have an answer, you may not have one. But what do you think things are going to look like for CRNAs in the future? Do you see any trends that?
I sort of do.
What do you see?
Because
What do you see, Chris?
we've got,
Well,
Where's the crystal ball? Yeah, I was just looking for it.
if you
Oh, wait a minute, it's right
have,
next to the broomstick over there.
if you have CRNAs needing their doctorate and you're raising the bar, and it changes everything. So it's going to so change
Decrease
the
interest?
environment of how doctors, surgeons, CRNA doctors interact with each other, how changes are made in the systems and healthcare. And I see it's such a dynamic time. And I think it's going to be awesome, just great.
Or like Helen says, input in making policy.
Yeah,
And
policy.
Stuff like, you're a doctor.
Absolutely.
Yeah, so that's good.
And making it more serious. I mean, nurses sometimes get a bad rap because, you know, Florence Nightingale, who was awesome, but was also
You can see her card in the nurse factory. Real talk with real nurses, ladies and
but
gentlemen.
was also seen as the caregiver and really to be taken seriously as a nurse. That's got to shift.
You should be more looked at as a practitioner.
Yes,
Yeah.
you're a professional
Right.
provider of whatever you're providing. Yeah, for all nurses.
Okay.
Just to let you know, though, Florence Nightingale was very headstrong, very take charge.
She was
and
a
she
badass.
told she told people what to do. There was no second-rate person for her. She started this whole profession, and she told those doctors what to do.
All right, Helen, do you have any, do you see anything in your crystal ball? Or?
Yeah, I think I would see growth. I would see growth in terms of numbers. I think there's going to be an increased need for the CRNA. I think as we move toward multimodal pain management and same-day surgery, everyone's looking to send the patient home that day, you know? And we're doing that more and more, and surgical centers are popping up all over the place. You know, it's the big movement toward reduce hospital length of stay, reduce patient pain post-operatively. And so with all these surgery centers popping up everywhere, we need to give anesthesia to those patients, right?
It's funny because
So-
I saw a thing where, you know, I was looking at unemployment for CRNAs, which is almost zero because of need. And Jim, you
Oh,
saw
yeah. I actually saw the Rand Corporation came out with a study in 2020, and they said there's a anesthesiologist shortage, but apparently there's an overabundance of CRNAs. So my question,
being
as
consistent with a zero.
Yeah.
which would be consistent, right? So my thought is that with the increase in the education and nurse anesthetists being required to have doctorates, are we going to see nurse anesthetists working independently without anesthesiologists as this is going forward?
They do in many states.
Right. So I think the big push for a lot of these, of course, with the research and everything goes, will also being able to work independently throughout the
Yes.
country, especially with the shortage of anesthesiologists.
I think so too.
Definitely,
Yes.
yeah. And like Chris said, they already are in many states, especially in rural areas
Right.
that are underserved. There are nurse anesthetists practicing independently without an anesthesiologist as a supervisor.
And I think in rural areas, most nurse practitioners work independently for those same reasons.
Right, yeah.
Those communities can't support having doctors, because of salaries and income and stuff like that.
Right.
All the more reason to see growth in the profession, I think.
Right. Right. So, do you think they'll, how they grandfathered in nurse anesthetists to become a nurse practitioner? Do you see that happening for
They would have to.
master's programs?
They would have to, or they'd lose people.
Well,
maybe.
well, not necessarily. They just limit their scope of practice.
Oh, well, I guess you could do that if they wanted to.
That's a good question.
Well, I mean,
don't know.
you can look at it as, do you know how some hospitals were requiring the nurses to have a BSN? In order to be, like I know in Philadelphia, in order to be a magnet hospital,
Right.
80% of your registered nurses needed to have a bachelor's degree. So that kind of pushed people to go back and get maybe if they had an LPN, they were going back to get a BSN. I don't know if that's going to happen with our field, but it could. I think it's too soon to tell. It's very early. They're not even all transitioned to DMP programs now. Right. But maybe someday they may say, in order for our hospital to have this accreditation, we may have to require all our CRNAs to be DMP now. And then they go back to school, which hopefully the hospital will pay for them to go back to
so
school.
So you went through a DNP program, but what you didn't have to do was you didn't end up doing research. Is that correct? Or?
No, I did a research project.
You did the research
We all did
project.
a research project, yeah.
Right.
That was what we needed to graduate.
So, I know my son being PhD, that they usually require you to have so many papers published and stuff like that. Now, I don't know is that happening now in a doctorate?
We weren't required to publish. It was optional, and they gave us all the resources that we needed. And I think a couple people in my graduating class did publish. They submitted their project to, a journal, a nursing journal, which is a lot of work, and it was a lot of extra work that, at the point where you're about to graduate my group did not, but you can publish, but it wasn't required. Whereas a PhD, you're expected to publish, I think, so, yeah, I don't know.
So,
Ready to wrap this up?
yeah. So, Chris, why don't you tell our audience what advice you would like to give someone about choosing a career in your specialty?
If they're thinking about it, if they're not even a nurse yet, or they're a nurse, or they're an ICU, or they're a med-surg nurse.
Well, financially prepare. It's not cheap.
Okay.
And your grades should reflect your wanting to be a nurse anesthetist. You have to be a good student. You have to be ready to buckle down and study your butt off. Pick study buddies that you like, and have a couple years of salary.
If you
Stash
can.
away.
Stashed
away.
away somewhere. Yep. Make sure your family's on board if you have a family, and If you don't, stay at home with your folks for as long as you can through school.
But the payoff will be worth it.
Oh
in
my
the long run.
God! Even if you're 50 years old, do it.
15 years of making a decent salary
Frank,
like that?
you could
Well,
still
no,
do
I'm
it.
at 59.
It's okay. You can still do it. It's rewarding, and you will have no regrets.
All right. Helen, what do you want to tell our audience about if they're thinking about becoming?
I would say
CRNA?
you need grit, and you need discipline, and you need thick skin, which a lot of ICU nurses already have, so that's good.
Yeah.
And you need to study very hard. Be willing to sacrifice 3 years at this point of your life. It's difficult. I would say I'm 36, and CRNA school was one of the hardest things I've ever done. It's not for the faint of heart. It's very difficult. But if you're ready and you're determined,
You would recommend it, and the payoff is
it's 100% worth it. And I would
It's
go
worth
back
it.
and do it again if I had to.
excellent.
Yeah.
Excellent advice.
And I will say one more thing. Make sure you have a strong support system at home. That's one of the biggest things that you can have.
That's
because-
everything in life, actually.
For sure.
Yeah.
Yeah, for
But I hear
sure.
you.
Because you're not going to succeed if you don't. You need financial support and emotional and mental support. at
Definitely,
home.
yeah.
And if you have all those things, then go for it because it's worth it.
Very good. All right, I think we're going to wrap it up. I think we touched on just about everything that we can. Thank you, Helen, and thank you, Chris, for coming out to our show. And
Wading through the floods and the muck.
yeah,
and
there's a little bit of a hurricane out there.
They
and-
have waders and boots on underneath the
Yeah,
table,
we
just to tell you.
risked our lives to get here, but
That's right.
it was worth it.
Jim, are we going to be able to afford these guys?
I hope they don't realize they are drinking their pay right there.
All right, so that's it for Real Talk with Real Nurses. I'm Frank DeFelice,
And I'm Jim Cassis.
and that's it for today. So thanks for
Thank
watching.
Thanks for having us.
Say goodbye, Jim.
Goodbye, Jim. Salute.
Hey, don't forget to comment. We'd love to know what's happening in your nursing world. Click the subscribe button and ring the notification bell so you stay in the loop. Thanks for watching.